Move toward the tail end of the dog, facing toward the head of the dog. This position will allow you to palpate the hind limbs in a more ergonomic way. Examine the interdigital area for foreign materials or dermatitis. Palpate the digits and look for bony or soft tissue swellings. Flex and extend each individual digit to check for joint pain. Perform long bone palpation of the metatarsal bones. Use a firm, steady compression to help you identify pain or swelling. Feel the tarsus. For normal dogs, due to the presence of an intact calcaneal tendon, the tarsus cannot be flexed with the stifle extended. In dogs with calcaneal tendon rupture, you would be able to flex the tarsal joint with the stifle extended. To perform tarsal flexion, you will have to also flex the stifle joint. Extend the tarsal joint. With the tarsus in extension, check the integrity of collateral ligaments by opening the side of the tarsal joint. Identify the lateral malleolus of the fibula and the medial malleolus of the tibia. Feel the space between the malleoli and the calcaneus. In normal dogs, this space should be concave and flat. In dogs with tarsal joint effusion, the space would be swollen and bulged. Now keep the hand on the tarsus. Slide your hand around the femur to look for the location of the patella. With the stifle extension, use the thumb and index finger to identify the patella. Push the patella laterally and medially to check for patella luxation. Twist the toe laterally, tarsus medially when you push the patella laterally, and twist the toe medially, tarsus laterally when you push the patella medially. Palpate along the shaft of the femur with firm compression to check for swelling or pain. Palpate the dorsal border of the pelvis. Feel the iliac vein, greater trochanter, and ischium. Iliac vein, greater trochanter, and the ischium. The 3 points should form a triangle with the greater trochanter slightly distal. Deviation of the greater trochanter may be indicative of hip luxation or severe hip dysplasia. Put one hand to support the dorsal pelvis. Wrap the other hand over the cranial lateral border of the femur. Perform extension of the hip joint. If you feel pain response, repeat the extension 2 to 3 times to make sure it's real. Perform flexion of the hip joint and abduction of the hip joint. Extension, flexion, and abduction. In young, slightly sedated dogs with severe hip dysplasia, support dorsal pelvis with one hand. Use the other hand at the level of stifle. Apply a proximal force along the axis of femur and abduct the hip joint to feel for subluxation or reduction of the hip. Always do a rectal examination to evaluate the pelvic canal. We will not do this in our dogs. Finally, gently pinch the toes to elicit withdrawal reflex. Observe flexion activity of the tarsal, stifle, and hip joint.